Good morning, good afternoon, good evening, my wonderful friends all over the world. Depending on wherever you are watching me from, it's your favorite dental and mental health expert. I am here today in the spirit of the World Oral Health Day, which normally comes up on 20th of March every year, to bring to your doorsteps some common causes of tooth loss. That is some things that can actually make you to lose your tooth or your teeth, especially as an adult. Now, I'm referring to the adult especially because as an adult, once you lose your permanent tooth, it is gone forever. There is actually nothing you can do to get it back. Anything you do to get it back would have just been for you to have an artificial tooth, an artificial teeth. But my focus is on what can make you lose your natural permanent tooth. And when you know some of these things, the main thing is for you to know that these things can make you lose your permanent tooth and know what to do so that you don't lose them, because it's very important. Like I said, once you lose your natural permanent tooth is gone forever. Now, one of the main causes why you watching me right now can lose your your natural permanent tooth is gum disease. In my previous post, I talked about bleeding gums. When people sometimes when they brush or they suck in, they notice that they notice blood in their mouth, as the case may be. So meaning that the gums are already diseased, kind of. And some of these things come about by um, food particles that remain in our mouth. They get into the gums, and we don't brush properly, we don't get these things out, they remain there. And once they remain there, one of the things they do is that they keep on going deeper into the gums. And once that happens, is what is one of the things we call periodontitis. And this periodontitis, once it gets to that chronic stage, the tooth can become mobile. You notice that the tooth is now shaking. If time is not taken, it can even fall off on its own. Because what periodontitis does is that it is inflammation of the periodontium. This periodontium is comprised of things that support, like supporting structures, things that hold the tooth in place. Just like a house that has foundation, if you go and remove the foundation, the house will collapse. So the house itself is standing on that foundation. So the periodontium is just like the foundation upon which the tooth is standing. So once anything happens to that periodontium, that foundation, the tooth standing on it, of course, won't have any other base than to fall off. So what it does is that it you know just compromises that periodontium, weakens it, so making the foundation upon which the tooth is standing weak. And of course, once the foundation is weak, the tooth itself will not have any strong base to stand on, and it will fall off. And that's why you notice some people who have maybe mobile tooth or mobile teeth, their teeth will be shaking, and before you know it, any little thing, the tooth will fall off. So gum disease is a major player or a major cause why people lose their permanent tooth. So please, anything that can make you have this gum disease, and that's one of the things we normally advise, that make sure you brush properly, make sure you get the attention of your professional dental person, so that can once you have any issues, you get to the dental clinic. And that's why we advise, even if once in 6 months, make sure you get a routine dental check, so that those things could be checked. If there is anything that is already um, growing around, maybe packed around your gums, by professional cleaning, those things can be removed. Because most times when we even brush, sometimes our toothbrushes cannot get to some of these places. So this professional cleaning helps to remove some of these things. It frees the gum, and once it frees the gum, there will be less potentiality of having gum disease. And once the gum disease doesn't come, the gum remains healthy. And as long as the gum is healthy, the tooth will remain strong and firm, because the supporting structures are firm and they are strong enough. So please, once you notice anything that is wrong with your gum, maybe you are noticing blood when you brush, or you just feel that you are not just feeling okay, once in 6 months, try to get a professional dental advice, professional dental attention. is very important. Like I say, most times when you go to the dental clinic, you may not necessarily even be treated. It may just be an advice. You could just be advised, or maybe to change what you are doing or to continue doing what you are doing, depending on what they must have observed from your oral health. So, but don't wait until it has gotten to a stage where it is now like an emergency, or there are a lot of pains associated with whatever that is happening to you. By that time, it will not be so comfortable for you, even financially speaking, or rather financially, in the case of finance. So please try to make sure that it doesn't get to that stage. It's very important. Number 2 on my list is dental decay or cavities. Sometimes people will say that they have hole in their teeth. When they eat, something gets into their teeth and all that. The thing is that once there is a cavity on your tooth, or in your teeth, as the case may be, and it is not treated as quickly as possible, when you eat, things will always get in there. Or even when you drink anything, especially things that has sugar, once they get in there, gradually the cavity will keep going deeper and bigger, deeper and bigger. And at a point, it gets to the root part of your tooth. And of course, you have severe pains, the tooth will be so decayed, and most times, if fillings can no longer solve the problem, and RCT, root canal therapy, cannot solve the problem, you see that the last resort will be extraction of that tooth, that is removing of that tooth. And once it is removed, your natural permanent tooth, of course, it is gone and gone forever. So please, one of the things is that once you make your visit to the dental clinic routine, it will be very easy to detect some of these things. And when they are still in the very early stages, very simple fillings can take care of these issues, or some things could be put on just to cover the cavity, and you won't have any problems. But once there is a neglect, you neglect it, or you think it is not yet time to visit the dental clinic, it gets to the point when the tooth as a whole will be lost. Number 3 is what we call oral trauma or dental trauma. This could come in form of trip-off accidents, car crashes. Maybe you fall to the ground, you hit, maybe your mouth and your teeth fall off, those kind of trauma. Or even when you use your tooth as tools. In one of my videos, I talked about some of these harmful practices. You see people using their teeth to open a bottle cork and all that. Some of these things can cause you to lose your permanent tooth, your natural permanent tooth. So if you are in the habit of using your tooth as a tool, please, or anybody that uses his or her tooth as a tool, please advise that person to stop. Meanwhile, remember, if you have not subscribed to this YouTube channel, please, I urge you to subscribe so that once my video comes up, you will be the very first person to get that information. And I also encourage you to like and share this video, especially to your friends, your family, people who that could be vulnerable to some of these things I'm already talking about. Please make sure that this video gets to them in whichever channel you can use to get this video across to them. Call their attention to this video. And if you have not subscribed, please kindly hit the subscription button so that once any of these videos come up, very, very helpful videos, you can also be the first to get this video once it is dropped. Then the next one is chronic illnesses. There are some of these illnesses that, just like I've used the word chronic, it gets so deeper in the person's system that it begins to affect every part of the body, and the tooth or the teeth is not an exception to this. One of them is uncontrolled diabetes, high blood pressure. They can actually, when somebody has any of these diseases or sicknesses, as the case may be, it will begin to take a toll even on the dental health. And that's why we normally say that the mouth is the gateway to the whole body. Most of the things that happens to the body generally shows most of the signs even in the mouth. And what happens in the mouth also shows the signs in the general body. So it's very important that any of these things that come up, we take care of them properly so that it does not degenerate into other parts of the body, which is also including the teeth. Then the next one, or the last one, is lifestyle. In this lifestyle is talking about the way, maybe the things we eat, for example, nutrition. In one of my videos, I talked about what we eat. What we eat goes a very long way to affecting our dental health. For example, if you consume a lot of sugary things, definitely it will lead to so many other dental issues that could make you to lose your tooth. If you are a smoker, somebody who smokes has 5 times chances of having his or her tooth lost or damaged than somebody who doesn't smoke. And that's why even some of the manufacturers, they will write it that smokers are liable to die young. It's not just about that, it affects every other part of the body, which the dental health is among, because there will be the cases of gum issues. Your gums will easily be damaged when you smoke. There will be stains, tartar, and all those things. They also have effect on the tooth generally, and they can actually lead you to lose your tooth. So please, if you are in the habit of any of these things we've just mentioned, or you know anyone who is vulnerable to any of these things we've just mentioned, so please kindly share this video to them, so that they can also learn some of these things and know what to do to avoid them. Even when some of these things have already set in, the timely seeking for the attention of a dental professional helps a lot in mitigating the effects of some of these issues we've just mentioned. So please, if you have not subscribed to this YouTube channel, you can just hit the subscription button, like and share this video to all your friends, your family, even your enemies. Just make sure that they get this video so that they can learn some of these things that can actually make an adult to lose his or her natural permanent tooth. And like I said, once you have lost your permanent natural tooth, it's gone forever. So one of the things we do is just to make sure to bring this information to you, to know the things you can do so that you don't lose them, because once you lose them, they are gone forever. So please, as we keep informing you, educating you on some of these things, keep being healthy, keep spreading this information, this good news to everybody who is around you. And until I come your way next time, stay well.